Coming up on Medwatch today, in the midst of the coronavirus crisis, the Marjaree Mason Center sees an increase in domestic violence calls. We have details on the alarming trend. And taking care of your mental health during this time is equally as important as your physical well-being. We have tips on what you can do to pass the time while you stay at home. Plus, doctors giving prescriptions to children and their parents for 15 minutes of play every day. Learn about this fun and educational new program with the toy maker Lego. Hi there, and thanks for joining us. I'm Connie Tran. As people are being told to stay home during the COVID-19 outbreak, leaders at the Marjaree Mason Center are warning home isn't always a safe place for victims of domestic abuse. The organization says it has seen an increase in calls since the shelter-in-place recommendations, and they fear victims may continue to be in danger as the coronavirus crisis continues.
We know and we anticipate that domestic violence is going to increase because with everybody home, the kids being out of school and everybody confined in one place, the likelihood of DV increasing is higher.
The Marjaree Mason Center has not been immune to the effects of the global pandemic. Deputy Director Leticia Campos says they have been extra busy.
After March 13th, after the schools closed, that first week, we did see about a 30% increase in our calls the first week.
Campos says they have received a lot more calls involving physical abuse.
So a lot more of strangulation cases coming through, a lot more punching, slapping, hitting, throwing objects.
They attribute the increase in these calls to the stress, frustration, and overwhelming feelings surrounding the COVID-19 crisis.
Domestic violence, as you know, is all power and control, right? One person exerting control over the other person. What we're seeing is these calls that are coming through, and even clients that are still coming to our administration building seeking support and safety, we're seeing more physical cases come through. So that's telling us that they're all confined, they're all staying in one place together. We know that the emotional, verbal, psychological abuse is still there, but now the physical abuse is starting to hit home a lot faster than when a client would be able to get out faster and seek that support and guidance with us.
The Marjaree Mason Center remains completely open with services available 24/7 as usual. They are fully staffed and prepared to take in an influx of adults and children if need be. To minimize COVID-19 exposures, the center isn't offering in-person assessments at this time, but they urge victims to call, email, or speak to someone through the Marjaree Mason Center's administration building intercom, where they can provide the same life-saving support they always do.
It's almost like a double-edged sword for our victims. It really is, because on one hand, everybody staying at home, it's for your health, for your safety, right? And then for our victims, it's, well, my safety is still at risk, if not greater now.
Campos couldn't help but get emotional as she talked about the trends of calls they have noticed since the outbreak.
You know, it was hard before COVID, and it's even harder now. Our biggest fear is that our victims aren't going to make it out alive. And not because of COVID right now, but because of domestic violence.
She emphasizes that their services are still available 24/7 despite the coronavirus crisis. Victims of domestic violence can call the Marjaree Mason Center's hotline or email the crisis response team. That hotline number is 559-233-HELP or 4357. And you can also email the 24/7 crisis response team at crt@mmcenter.org. The outbreak of the coronavirus may be stressful for people. Fear and anxiety about the disease can be overwhelming and can cause strong emotions in both adults and children. Coping with the stress in a healthy and productive way can make you, the people you care about, and your community stronger. Psychologist Dr. Mike Rubik has tips to help us get through this difficult time.
You know, this is a difficult time for many of us. Part of what is challenging about it really is the loss of control that people have. And so with the COVID-19 coming upon us, then you see business closures and you see lack of availability of products at the stores, and your routine has been changed. And so there are a lot of things that have happened because of the situation that's upon us. And so it's often a question for us to wonder about, how do I deal with this, or what do I do? You know, maintaining some sense of balance in life comes from devising a plan. Plans are helpful because they give you a sense of control. And so even just looking at your day and saying, what are the things I want to accomplish today, or what are things that I can do today? So then it gives me a greater sense of I have control over my day, rather than I'm just lost with nowhere to go, nothing to do. I've got to keep social distancing so I can't see anybody or talk to anybody. Or instead of focusing on all those things you can't do, then make a plan. And in that plan, find some common elements from your normal day-to-day routine. Build a nice, comfortable meal plan. Figure out an exercise routine. Watch something on TV that will guide you through an exercise, or download an app for mindfulness or meditation or something like that that can give you a little bit of something to do during the day. Tape your favorite show. You know, again, those are just common things that you do every day, or have done many days of your life, that have brought about a sense of calm, relaxation. Can you find a plan that helps you to develop balance, doing things that are pleasant, positive, fulfilling, meaningful, enjoyable, more so than the burdensome, difficult, struggle, task kinds of things? My wife pulled out a puzzle, put it on the card table in our living room. A puzzle's kind of fun. You can focus on simple things like that. I love to work out in the yard. So again, a little weeding in the garden, or flower beds, just some things that, again, part of your normal routine, help you to find a little bit of balance. Some of us are isolated and we feel like we're alone and have no one. So maybe it's just a phone call or a text that does that. And if you can't find that someone who will be encouraging and supportive, sometimes people are more quite quote the downers. They bring up the negative things and they scare us more, or they stress us more. So find someone who can contribute in a positive way. And if there isn't someone like that, then there are helplines. Many of the therapists in town here are opening up telehealth opportunities, so you can call and speak to someone. You can have a video chat with a therapist and get some encouragement and support, and have someone to share with. It really is a big, important thing when we reach out and we talk and we share and we feel things together and get some reassurance and some comfort. It makes a big difference.
Governor Gavin Newsom spoke about the stress and emotional struggles Californians may be having during the shelter-in-place order, and pointed out resources for people who are suffering emotionally and physically. During one of Governor Newsom's daily COVID-19 updates, he was joined by the California Surgeon General Dr. Nadine Burke-Harris to unveil a set of behavioral and mental health guidelines for people to consider during the coronavirus pandemic.
The good news is that there are simple ways, simple things that you can do every day at home to protect your and your family's health. Safe, stable, and nurturing relationships help to protect our brains and bodies from the harmful effects of stress and adversity. Healthy nutrition, regular exercise, mindfulness like meditation, good sleep hygiene, and staying connected to our social supports and getting mental health care all help to decrease stress hormones and improve our health.
Coming up on Medwatch today, we recognize the great teamwork of a unit at Community Regional Medical Center. Find out how they've lent a helping hand to other departments. And children and their parents are following doctors' orders to play. Learn about the Prescription for Play initiative with Legos.